Omicron subvariant BA.2 tonight makes up most of the COVID cases that we're seeing across our country. As Rachel Krause tells us, this news comes as our nation's health leaders approve another booster for adults 50 and older.
If you're headed out to the grocery store or to the pharmacy, soon many adults will also be able to pick up another COVID-19 booster shot. The FDA and CDC authorizing a fourth mRNA vaccine dose for millions of Americans.
When folks have been boosted, it does provide a higher level of protection against severe illness, hospitalization, and death, which is particularly important amongst our most vulnerable population.
Dr. Christopher Doring with Franciscan Health Central Indiana says vaccine protection and immunity from illness starts to wane significantly after 3 to 6 months. So that second booster shot is a good idea for those at high risk. But he says if you just had Omicron a month or two ago, you may want to hold off for now.
Right now, we're holding up really well against the BA.2 and the other Omicron variant.
CDC data shows the BA.2 Omicron subvariant now makes up 54.9% of COVID-19 cases. But case numbers overall are still low compared to the Omicron surge from months earlier, even as BA.2 quickly spreads.
The severity of the illness doesn't seem to be quite as high as it has been with prior variants, particularly the Delta, but it does seem to have a high level of contagiousness. The good news is it has sort of come onto the scene at a time when we do have good widespread immunity from the Omicron surge and from the combination of those who are vaccinated and those who've been boosted.
After 2 tough years of this pandemic, he says he's hopeful we're finally inching closer toward an endemic level with COVID-19.
We are approaching a point where this is much more manageable, and certainly we hope that with future variants, maybe that would emerge, they would become more like normal and annoying coronaviruses as opposed to ones that have the severe illness and death associated with them.